Hi, I'm Dr. Lisa Konick from Konick and Associates. Welcome to our Ask an Expert Parent Education Series. This session is going to be focusing on recognizing the warning signs of substance abuse in your teen. And this is a three-part series. Today, I have with me Amber Konopa, one of our clinicians.
Hi.
And Amber's going to be speaking to us about the warning signs of substance use in your teen. A little bit first about our practice. Konick and Associates is a family behavioral health practice located in Naperville and Orland Park, Illinois. Our clinicians specialize in research-based treatments across the lifespan, and we start as young as 3. And we do have a fair number of teens in our clinic and we also work with parents on these very issues. So we are going to be sharing some information and some insights to help you to be more educated on these risk factors. So let me introduce our clinician, Amber, today. Amber Konopa specializes in substance abuse and co-occurring problems, anxiety, depression, challenging behaviors, and treatment-resistant issues in adolescents and adults. Amber is a licensed clinical professional counselor, a certified drug counselor, and a certified recreational therapist. Amber, tell us a little bit more about your experience and background and how it pertains to this talk today.
Well, thanks, Lisa. So I have a unique background when it comes to me doing counseling with people who are young and older adults. It started back working inpatient psych in Cook County. And back in the day when I went to Triton College for my CADC, which means Certified Alcohol Drug Counseling, that was back in 2002. And so back then we called it MISA. So over the years, it's changed to now co-occurring, meaning 2 diagnoses: first, substance use, and second, mental health. And so seeing severe mental illness and substance use, and then also working various inpatient programs with geropsych, seeing very older adults experiencing substance use issues, to working detox, and then working in outpatient, and seeing different people in different levels of care and understanding where people may need residential or detox, which really helps a person like myself be able to see the whole spectrum of where people are at.
And one of the things I love about Amber, you are a certified recreational therapist. So Amber loves to bring in some unique factors when she's working with teens, particularly with music and, kind of connecting with teens on a unique level in that way.
Yeah, I actually, not too long ago, we did a creative drawing to tie in the different dynamics that were going on, that sometimes speaking doesn't do much. And so it doesn't matter if you're an artist or not. It's just a way of tapping into a different way of understanding what's going on with me and how this fits. So using creative approaches really helps people to kind of break the stigma, because there's a lot of stigma attached coming into counseling, let alone within the substance use world. And so being able to break that stigma and educate in a creative approach it's really fun. I like it too. So, and it's really cool.
So Amber, getting to the talk today as it relates to substance abuse in teens, this is certainly a question that a lot of our parents are asking. At what age should parents be thinking about substance abuse risk and exposure in their kids? And I think it's a lot younger than they may expect. What is your experience with that?
Totally. And so I would say first is taking a look at the culture within my family. Some families where alcohol and substances it's just part of the dynamic. And I would say when your young one is going out and venturing out into the world, that is a great dialogue to have about just becoming aware. And it doesn't mean like, oh, you don't want to say, oh, the risk of overdose, where you have an elementary kid, they have no idea what that means. So you just want to besides stranger danger, in a way, you want to be aware of what you agree to take, who the people you're around, and who you can call if you're not feeling safe. Because so many people who I've worked with, young and old, are like, well, I didn't know what to do. and I ended up taking whatever. So, I would say elementary. And then and then as a young person, and depending on what you're noticing around the house, you can then, gravitate on what you want to talk about. But that's why I think you and I are doing this, is to also to say, hey, we're also a resource, because there's so many times where people want to keep it in the family, and we'll do the best we can, which of course is important. At the same time, substance use has got its own way of really taking over not only the individual, but the family itself.
That's a great point you bring up. And, I think parents are thinking, talk to your adolescents when they go to high school about this, or even into college, but it does matter about what the exposure is in your world. Like,
Yes.
I think about the emerging adolescent, the identity development as kids transition into middle school tends to be a time where you're giving them a little more autonomy. They're going to be connecting with friends, and that's often when a lot of kids will have that first exposure to nicotine, or we're going to be talking about some of those exposures in a moment here. But also, if you have family members who drink a little too much on,
Right.
Party, family gatherings, or, that's known, it makes sense to start having those dialogues with your child about safe and unsafe behaviors.
And it makes it and it's not like anybody's doing wrong or right. And sometimes we only know what we know. But if I have had experiences within my family where I didn't have a bad problem, and that makes it seem like it's okay to go out and do this, it depends on the person, because not everybody's going to become addicted to a substance. However, that's why we're talking about this, is here's the risk and the warning signs with this, when, oh geez, I don't know about this, where I can go for assistance.
That's a good point too. I think a lot of families will have people over for a football party, or, mom and dad have a glass of wine at dinner. That's not having that responsible teaching makes a lot of sense too. Absolutely. What is responsible and what's irresponsible when it comes to substance use?
Right.
Now, another question that comes up a lot is, what are the pre-risk factors that draw teens to a drug using crowd? And we're kind of talking about teens, but I think even preteen is really in that space, is when we're starting to get that exposure.
Well, I would first say that throughout our generation and generations, we get exposed to music. And if you're into musicals, if you're into TV shows, commercials, the Super Bowl just happened, drinking and partying looks a lot of fun. And when you listen to music, a lot of music can really make it seem like it's okay. And so, besides when we were talking about like the culture within the family, you got society culture, and substances has been around from like ancient times and whatnot. So, but now bringing it back to 2022, risk factors are also with, trauma, what's going on with a person's experience, what's going on with learning, socioeconomic issues can also play a factor, family conflict and whatnot. And then a lot of times it's that, there's a genetic component to all this too, where, depending on what's going on and I'm not aware, and you're afraid to tell your teen, hey, you want to be really careful. How do I have that dialogue with them? So there's all these different types of things to look out for. So, and also what's going on around the home. Now, if you've got an externalizing teen who shows their emotions and is expressive, and then they start to isolate, that could be a red flag. Or if you have a teen that is more withdrawn and they're looking more excitable, or looking, I'm giving really opposite ends of the spectrum, but or if you're noticing funky smells, or their eyes seem to be weird and different things, you really want to ask, because so many times parents are like, I don't know what to do. I'm noticing all this stuff, but they'll figure it out. Well, that's the scary thing with substances. If you leave it to them to figure it out, the substance is going to take control, and that's where prevention is important.
And I also think when a lot of the kids, when we're looking at coping strategies, kids don't have a lot of solid strategies in some situations. They're learning how to develop these strategies to cope with stressors.
Right.
And if they're not having good models around them for how to manage their stress, and I'm not just saying mom and dad, but any models, parents can be
Right.
wonderful models for how do we manage stress. But when we see kids with these co-occurring ADHD, for example, learning issues, they have a lot of stress academically. They have a lot, maybe having some social stressors because their impulsiveness kind of makes it difficult for them to interact well with kids, and they can get maybe some exclusions or with, isolation. They're going to be look for social connections that are accepting. And
Right.
unfortunately, if they don't have the good coping strategies, what we often may see is kids turning to kids that have high risk, who are
Mhm.
very welcoming, but may not be the best peer source of support for them.
And then if I may, I'm gonna flip it to the positive. Now, let's say you have a very proud, athletic, popular type person that puts themselves out there, and it's like, wow, look at what they're achieving and whatnot. Part of the teen development is being connected with my peers, finding my way, and everything like that. So sometimes positive influence and what's going on can also put pressure on a person to have, because of their status with their friends and with school, put pressure on to be like, okay, well, here we go, and it makes it easier because if I'm making any sense with that,
That's
what I mean?
absolutely right. The high achieving kids are not exempt from this. The socially popular kids actually do come into our practice and say they have a lot of pressure because they don't want to get kicked out of the popular group. So if the popular group is engaging in risky behaviors, it's really hard to say no and still maintain their social status.
Right.
The other thing that we see, and Amber, I'm sure you see as well, is those stressors that are not just academic but family stressors. How do we
Correct.
get our kids supported when there's divorce, when there's abusive situations, when there's if there are factors in the home environment or in the extended community that are creating stressors, bullying, for example,
Right.
those can be very isolating situations for kids when they don't have a lot of resources. They could turn to substance use as a way to cope as well. So we see those risk factors being present.
Mm-hmm.
ADHD is another one that I don't want to, there's a question that comes up, and I'm curious to hear what you say about this, because I have kids that'll say, well, why should I medicate with my, pharmacology or stimulant medications when I can use substances to manage my symptoms? And that's another challenge, is that there is a difference between prescription drugs to manage symptoms of neurodiversity such as
Yes.
ADHD, depression, and anxiety versus substances of abuse.
Yes, and that also ties into our next week, or is it in a couple of weeks? I
Next
forget
week,
now.
we're going to be
Next
talking
week,
about the brain
brain
development.
development and teen substance use, and so a lot of adults and teens can go back and say, hey, going with the ADHD symptomology, that when I smoked, it evened me out, and I felt more focused. So sometimes substances, a lot of people think, oh, the negative and everything. No, there's positive receptor sites that start to get activated when I noticed, wow, I'm able to do this. But the scary thing is where you don't know what's in it, and you don't know what's laced. You don't know where that person got it from and everything else like that. So that's why going to a doctor and not being your own doctor is also important. Or if a parent's like, well, you can take one of mine. Well, pill popping is quite common amongst teen substance use. And so you don't want to, that can also be a risk factor too. So you really want to, because of the developing brain, you really want that person to go and get assessed, because who knows, they may not need meds, they may need behavioral approaches. And that's why counselors teach behavioral approaches and whatnot.
Yeah, we'll talk a little bit about that topic more next time. Let's talk a little bit more about the social influences, Amber. What are some things that parents should consider with regard to peer or social influences when it comes to substance use?
Well, you really want to know who they're hanging out with. What's going on? What's it looking like? Sometimes people want, of course, teens want their space, and of course, because they're finding their way and whatnot. But you really want to be aware of what's going on in their day to day, and how are they managing their time? What are they doing? And then, I always go with, you really want to give a person the benefit of the doubt. However, if you're noticing risk factors, that's where it's good to look at social media, what's getting posted, taking a look at the phone, taking a look at the room. And a lot of teens are like, you can't go into and adults for that matter, you can't go into my room. And however, if you're concerned, you really want to take a look at the room and looking around and, picking up different stuff, because people can be quite savvy.
I actually talk with families a lot about how much control and freedom do we want to give kids? And I think giving kids too much freedom too early, and too much privilege of privacy before they've demonstrated the ability to be responsible with that privilege of privacy can be a counterproductive problem later on. As kids get their first cell phone or their computer with their gaming tag, and they can do Discord and start communicating independently of you, I think it makes sense to start talking about those privacy limitations. Like, hey, I reserve the right as your parent to check on you because I care about you. And I want to make sure that those communications that you're having with your friends are healthy. So I do reserve the right to check in on you, which might mean checking your social media now and again.
Right. And also, and in gangs are not just in the South Side and the West Side. Gangs are all around. And so a lot of times, because peer influence is so important, you can also look at the risk of who are they associating. It doesn't matter. It doesn't mean that I got into this gang. It could also be being associated with whoever. And then you really want to look at, of course, the knee-jerk reaction is, what are you doing? Like, you really want to try to understand, where is it coming from? Try to understand what's going on in their mindset to then seek out these type of people. And in their mind, it may be like, well, at school, I'm having a really difficult time, and this makes me feel like I got an edge, or I got people who I can turn to where I don't feel like I do. And so having that, and again, getting the person the support that they need and taking the time out to talk. So important to talk. So many times, so interesting as we're going through this, and I'm reflecting back on my experience, that so many people in all types of consequences are like, if I had people that would spend time and talk to me, and I know I wasn't probably looking like I was aware, or I didn't want to, I just wanted people to take that time. And then also, when I used to run recovery support nights with families, and having the families say, I did not know, or I thought there was something going on, and
they didn't check on it.
Exactly.
And I've seen parents share, and kids share with me, they're getting connections with drugs through Snapchat. So it is a savvy parent to say, let's do a check-in now and again with the social media. I just want to make sure you're safe. Right. With that too, the other piece, I think the other risk group that we didn't mention yet is the LGBTQ community, and that sense of feeling connected, and the stressors unique to individuals in various, minority populations, kids that are bullied, victimized, or marginalized in some way, could be at a higher risk for substance use
and trauma. And if teens experience some type of assault, in physical or sexual, that the percentage of people turning in true substances is really high. And there's some really, and maybe at the end I can share some resources where people can go on and where we're getting our information, because it's absolutely fascinating.
Amber, what are some of the behaviors that you might see in a child who if a parent's looking to, that might raise some suspicions. And we're going to talk about specific drugs in a minute, but like just in general, one of the things I usually coach is if you see a big change in peer group, that might
Yes.
be a signal to be attentive. It doesn't mean they're using drugs, but because some kids make shifts in peer groups for healthy reasons.
Yes.
And this does occur a lot from the transition from 5th to 6th grade into, middle school. A lot of changes occur in the peer environment. But it's certainly important, I think, to look at those peer changes and what type of shifts are they making. What other factors might you see in kids that raise suspicion?
The grades, sneakiness.
Yep. Keeping that backpack coveted.
Yes.
It goes everywhere with me.
What was that?
Carrying the backpack and it never goes out of my sight, or some object of that nature.
I look glued to a certain object or whatnot, or, I got it rushing out, and going back to when we were talking about the social piece, again, it goes back to even the positive reward, the high achieving, the, athletic, in the drama, wherever is going on, there's also influences within that too. Like, wow, this person is spending way so much time out with their friends, and, or a person is very isolative and they're staying within their own home or with only certain type of people too. That can also be a risk factor. Noticing the eyes. So a risk factor, we'll get to it though, is noticing the pupils. Pupils can also give an indication of what could be possibly going on too. Hygiene, eating way amounts or not eating at all, or sleep. Sometimes a lot of insomnia is really, that is one of the common side effects with substances, is lack of sleep.
Let's talk a little bit.
Fighting. Oh, can I, another one?
Yeah, add one.
Picking fights too.
What was the last one?
Picking fights.
Picking fights. Yeah. So increase in agitation. That's a good one. That's a good point to think about too. What are the signs to look for? We talked a little bit about the influence. What I want to talk about is, let's look at some of these specific substances a little bit more.
Sure.
And what parents might be looking for if their kid's under the influence, maybe using. What are some of the signs, paraphernalia that they might be looking for? And starting with vaping, because that's an interesting one. And I remember there's always this, vaping is a gateway. Smoking used to be a gateway drug, nicotine. What are your thoughts about that? And what should parents be concerned about when it comes to vaping? Because I think vaping is becoming more popular than cigarettes.
Yes. Vaping looks fun. I can get flavors. I can, there's all, it makes it look cool. And a lot of teens look at the status. It makes them look older, mature. But you can look at that through generation too with cigarette smoking as well. And as it is a gateway drug, I don't know, because for the people who become addicted or have a substance use disorder diagnosis, they're able to look back at the time when they started, smoking cigarettes, because you get a buzz. And it's like, man, I did not smoke cigarettes like normal people. I just wanted more of that. But not everybody who smokes cigarettes becomes addicted or goes on the path of using more. That's why getting educated on risk factors and knowing your teen is really helpful to see what's going on, because some people probably should not be smoking cigarettes, So when it comes to vaping, how you can tell the difference between a vape pen for THC and a vape with cigarettes is you're going to smell the cannabis smell with a vape. So, but you can also smell cigarette vaping too, because it's fruity. And some have a very cinnamony or a musky smell. And, what are the guidelines at home for allowing vaping to go on?
And vaping can be very sneaky. Kids can hold a vape under their hoodie, and it doesn't leave smoke. So if it doesn't have a scent, you can be pretty sneaky with the vaping. But I think, like you had meant, we were talking a little offline about, it's new, so we don't really know all the long-term risks associated with vaping. Amber, is it something parents should be concerned about if their kids are vaping? Are there health risks associated with this?
Oh yeah, you can go on. So as I was researching, because as a substance use counselor, and when you're working with primary substance use disorder, nicotine is one of the most addictive substances. However, when you're working with people who have almost died because of alcohol and other substances, it's really teaching people how to get into remission. And so, and this was a great education for me. There are a lot of physical and not only physical, but cognitive risk factors that go on as well, and with the lungs. So vaping is nothing to mess with, because it can really can affect a person.
So it is not healthy. What are some of the things that kids are calling these now? Let's give it a little lingo here educationally.
Like a cartridge, e-cig.
Vapes, obviously.
Yeah.
I hear carts.
Yeah, carts. Yeah, cartridges. And then each brand has their own percentage of nicotine, because some people may be like, well, it's less nicotine than with regular nicotine. Well, you're getting more chemicals with vaping as well, and that's not good for the body, especially with the brain developing too. So putting in more chemicals when chemicals are already getting activated, it's a lot.
And how about, let's talk a little bit about marijuana as well, because that's clearly been an interesting development with the legalization of marijuana in various states. And kids get this impression, well, if it's legal, it's not dangerous and it's not bad for me. Even though we can remind kids that alcohol is not good for you, and that's legal if you're an adult. And the other important factor to point out, I point out with a lot of our adolescents, is it's legal for adults, not for kids.
21 and older to go to the dispensary.
So tell us a little bit about, I've heard a lot of, how is it different from when parents say, when I was young, little pot maybe wouldn't hurt you. Everybody's experimented a little in college. What's different about the marijuana that kids are getting?
Everything. Everything. The THC is absolutely, it's amazing. So
and THC is the explain what that is in terms of the.
Sure. So you have THC and you have CBD. CBD, I'm going to flip it. So CBD is, you're not going to get a high from CBD. Now, the scary thing is that you can get CBD everywhere. However, from working with people who needed to get drug screened for legal or employment, and they're taking CBD and then they test positive for THC, it's going to affect a lot of different things, especially if your teen is wanting to go work too. So you got to be really careful on saying, okay, yeah, I'm going to purchase CBD when you don't know what's in it, just like with when we were talking about vaping. So THC is what gets you high. And so there's different types of cannabis out there. And so you've got flower, the plant-based. And so, and also the whole wax, resin, that is extremely, extremely high THC. And it really affects people, teen and older adults too, where a person may not even be aware that they have some sort of mental health or some sort of medical issue that can get triggered and whatnot, because you're ingesting high amounts of THC that just, it can really make people very depressed, can make them psychotic. It affects sleep, and it affects that overall mood and stress sensitivity. And so cannabis is way different than the way it is, because of the way the hydroponic and technology and everything else. So, I mean, and there's adults who also can't smoke marijuana because it will lead them into other substances.
And it's interesting. I've heard with the edibles versus, the different mechanisms of you could smoke marijuana still in the flower form, like you mentioned. You can, use it through a cartridge, which is be similar to vaping. And then you can also utilize the edibles, and the edibles, I think we're seeing kids in emergency rooms because the high that you get from an edible takes longer to kick in, if you will.
Right.
Is that accurate, Amber? And so
because
they're
when you
ingesting
smoke-
more than they are aware. There's not a quantity that you can track with the edibles.
Right. Well, and when you smoke, it goes straight to the brain. But when you ingest and the time that it takes, and it's like, oh, I'm not getting my high, let me take more. You take more, and it can lead to severe vomiting and having to go to the hospital.
Yeah. So it's if you could, overdosing in a sense on it. I think it has definitely been a very different look in this, and kids are able to get high anywhere with the cartridges. They can get high in school.
And you can eat stuff too as well. Like I can have, hey, try this cookie, try this brownie. Or if you're a person who may tune into this and say, well, I have edibles around, you got to be really careful with younger children and animals, and what that can do as well, because it can look very innocent. And that's the whole thing with substances. And the sad thing is that depending on socioeconomic status, some people cannot go to the dispensary, which is a safer route. I'm not saying that it's safe for everybody, but it's safer. So if I'm buying it on the street, I don't even know what it's laced with. And again, drug screening people, I've seen people say they turn positive for opioids and benzodiazepines, because if I'm a dealer, I know how to make my cut and get people to come back. So, you're really trusting. So that's why, let's go full circle. When should I start talking? As soon as your teen, or as soon as your young one is leaving the house, to, kind of have a way of saying, hey, you really want to be careful and what to look out for and how we're available. If you have anything pops up, you can always call us, because you never know what's out there.
So as they're leaving the house, that's an interesting way to think about it, depending, because kids are going to have that freedom in different ways at different ages.
Right. And that freedom looks different at different points, as a person gets older.
So the takeaway with CBD is it's not going to get your kid high, because we do see it in lots of products now. I think it's very trendy, but there could be low doses of THC still lingering in there, is what you're saying, Amber.
You just never know. I mean, you can go anywhere and get this, and it's like, and also, people, when you look at teens and status and wanting to be accepted and whatnot, so, lingering into these types of behaviors, what is this doing? What else can a person be lingering into? What other activities and hobbies can one get interested in instead of the world of substance? Because you just never know where my suspicion may take me, and curiosity. Because being a teen, it's all about being curious, and substances make it really curious and can make it really interesting. But how can I have a curiosity in my natural way and find that natural fun without the high? Because once you forget that, it's hard.
That's a great point, Amber, because I do think kids see, this is what I see a lot with kids moving into from elementary into middle school, and their friends start to branch off into different peer groups. And if your long-term friend starts dabbling in nicotine or vaping or cannabis, and it looks fun, it's going to raise curiosity. And how do you have those conversations with your kids at home to protect them so that they feel safe talking to parents about these things?
Right. Because
and not finding the information on the internet or through their peer group, which is not always the ideal resource for them.
Social media. Exactly. So a lot of people, I want to take a step back and let them find their way. No, you really want to, parents really, really have a lot of control with all this. And they really do. And as much as working with teens that really don't care, being able to have a parent level with them, that's, they're not going to say, oh, thanks. I mean, sometimes you may hear it, but I'd be like, oh, thanks for that education. But you know what? It registers with them.
I think it does. I think it registers that my parents are on top of this a bit. Let's talk briefly, Amber, what are some of the other drugs that parents might or kids may dabble into, as they're, we're talking about middle school, high school age. What are the potential things they could be exposed to? And what are some of the names that they might be referencing in these different categories? So parents can be mindful if they see it on their social media, if they hear their kids talking about it in some way, texting, that this could be, they're talking about drugs.
Yeah. And I would like to start with alcohol. A lot of society has minimized alcohol and whatnot, and alcohol is quite dangerous. Alcohol and benzodiazepines are two of the deadliest substances because of the withdrawal effects, which is seizures and also delirium tremens. And so DTs is another way of saying it. So alcohol, a lot of times when people are dabbling, alcohol is right along with everything else. And so alcohol is not to be, minimized at all. And that can really affect brain and development that we'll talk about too. Going with benzodiazepines, some street names for that would be K-pins, football, ladder. So your benzodiazepines, Valium, Klonopin, Ativan, Xanax.
And these would be prescription drugs that kids can either buy from other kids or they may find them in your parents' medicine closet.
Exactly. So depending on where they're going, or a young person, younger than high school, and they're seeing a person, prescription bottle, that looks safe or whatnot. No, because again, if I'm dealing or I'm trusting another person, I really don't know what's in that pill, because pills can look like a pill when it's not. And so, and just because somebody is prescribed it doesn't mean that I should be taking what another person's prescription is. So
what are some of the symptoms that a parent might see if the kids are either on a benzodiazepine? I think we all know what alcohol looks like, but what would a benzodiazepine high look like?
So a lot of people, so when you see a person high on a benzo, it's similar to alcohol because of what goes on in the brain. They're both a depressant, right? But with benzos, a person looks more confused. They look more like muscle. What's the word I'm looking for?
It is a muscle relaxant. So I think
yes, and it's very blurring, not making any sense, and the lack of motivation. And sometimes people can have the opposite effect, like opioids. That's another substance that people need to be aware of. And how you can tell with opioids is the pimple. I mean, the pupil is the pupil. My pupils will look like a pin, like the tip of a pen. And that's how you can tell if somebody is high.
So they're very dilated.
No, opposite. Like if you look at the tip of your pen.
Oh, I see what you're saying.
They go like
the opposite of dilated. Yeah.
The opposite. Yes. Like hallucinogens, the pupils are going to get big. But with opioids like oxy, codeine, heroin, fentanyl, morphine. All those opioids are going to make a person not eat. They can complain of physical complaints. They will look like they're nodding, and a very high-pitched swirling sound in the throat and whatnot. And again, opioids are very scary as well, just like with benzos, on the risk of what could be possibly in it. But with fentanyl, if you look at $50, that's enough for me to be able to ship it across international ways through the U.S. Postal Service. And then a small amount can cause a person to overdose.
Yeah.
And
So
so
these
it
are pretty
feels,
dangerous,
when you
and they
look,
are being used in teenagers. I think
yes,
parents don't
yes,
realize that they could actually get their kids are able to get their hands on these types of
yep,
drugs.
yep,
The other one that I think is a very trendy one in certain adolescent populations is the hallucinogenics. Tell us
yes.
about those.
Oh, the hallucinogens. Yes. And so with hallucinogens, cannabis is actually in the category of hallucinogen and a depressant, sidebar. Your hallucinogens would be your acid, the shrooms,
Which I've
well,
heard
the
mushrooms aren't
DMT.
bad because they're natural.
Yeah, right. But they grow under poo. So, you know, and hallucinogens can be fun for some young people because it makes things look really, Alice in Wonderland. And it makes me have this other higher experience. And and with teens and like finding their way can be very like this is my way of getting connected and whatnot. And so the scary thing is that with acid especially is that it's stored in the cerebral spinal fluid. And so once you do one hit of that, it's in you for the rest of your life.
So
And
you could
so
have an after effect even at a different
definitely,
time point.
like different colors and looking at certain like what some people say, like I'm able to just sit and look out at you and everything starts to move. Or if I crack my knuckles, it gives
Are
me
are there
colors.
any over-the-counter drugs that fit into this category, Amber?
You want to be careful with the cough syrup because that can look like a hallucinogenic effect. The quercetin, and it's very common for some to be able to buy boxes upon boxes of this.
Which is why they started putting this behind, if you notice in your pharmacy,
Yep,
there's certain over-the-counter meds that are now you have to ask from the pharmacist and show an ID. And is this the
yep.
reason, Amber, due to the hallucinogenic properties of some of these?
Yeah, the Sudafed, how they make it too, how like with crystal meth, that how they manufacture it and whatnot, but also Benadryl. I've known over the years where people get off or they can't get their like an opioid or heroin, where I'll then ingest a lot of Benadryl because I get that down drowsy. So yeah, over-the-counter meds can really elicit that substance use path in the brain and whatnot. So, but
So
yeah.
parents need to be mindful. Kids could be doing this too.
Like if you're seeing wrappers around, different types of, like wrappers of the pills and whatnot, or lots of candy and looking like syrup and whatnot. Syrup is coating and then, mixed with, Skittles or Starburst and whatnot. So, understanding the substance and what comes with it can also help. Like, what does this room look like? What's going on here?
Let's talk the one other one that we haven't touched on yet, I think, are the stimulants.
Oh yeah, like Coke, crack, the ADHD meds,
And
caffeine.
we're talking about ADHD meds that are taken in a different quantity or used for a different purpose.
Correct, to get high. Because some people feel that when they use uppers, that's another way of evening them out too. For example, like working with people who have bipolar disorder, a lot of people, when they ingest crack or Coke, that they feel that this evened me out with my mood. And so, and another thing, I know we talked about vape, but also the Red Bull and the Monster, there is a lot of caffeine that's in it. So if you're listening and you have someone, even an adult, that is prescribed psychotropic medications, you really want to be careful with your caffeine intake because that can really wash the effectiveness of the psychotropic med too. And so And then, if you're finding a powdery substance, some people don't know that they can get it tested at their local police station. But sometimes they don't want to do that because they don't want to get the person in trouble. And that, the stigma attached with certain things that go on in the home, where what are we inviting in now?
I do want to highlight kids that are on ADHD medications that are prescribed and managed by they're either their pediatrician or their psychiatrist. We're not talking about that. We're talking about kids that are using stimulant medications like Adderall who are not prescribed Adderall. Because I don't want parents to be fearful that if their kid is taking medications to manage their ADHD, they're going to be at risk for addiction to it. That's not what we're referring to here. We're talking about the abuse of that drug for not medication purposes.
You can even take this, a good point, with let's say I have chronic pain or I have anxiety, that anxiety depression piece, and I am prescribed an anti-anxiety med. Now, I went to a really awesome CEU, and the man's like, those of you in the substance use world, you can't just blanket say, oh, that person's addicted. No, that is where physical dependence comes in, where I am now physically dependent. Doesn't mean that you're addicted to a substance. It's just, that physical dependence piece, which is completely different.
It's very different, yes. And I don't want parents to be afraid to give their kids their ADHD meds because it absolutely is helping them. Please believe us. It really can help them and divert them from some of these problems, because we don't want them to self-medicate in other ways with marijuana and other things if they're not managed well with their actual mental health or neurodiverse challenges.
Good point.
One thing that I do think is really important. And Amber, you mentioned, testing a substance. You can test your kid. There's a lot of over-the-counter kits available in pharmacies now, where if you do have a suspicion that your child is utilizing nicotine, marijuana, or any of these other drugs, you can get a home drug kit and have them tested at home.
And when it says different panels means the different substance that's getting tested. Mm-hmm. And they have some that are just a few. And then they also have drug screens out there that are up to 14 that you can buy. So,
and they're pretty quick. I mean, it's usually a urine test at home, and it gives you the results rapidly.
Yes.
Last thing I want to cover today before we close down is, how do I talk to my kid about these things? And Amber, you had some do's and don'ts that you really wanted parents to be mindful of. Because if we approach this ineffectively, we could really isolate or, create more division rather than support in talking to our kids about some of these challenging topics.
Right. And so your knee-jerk reaction is, what are you doing? You want to shake them and whatnot. However, try to take a look at, you don't want to yell. You don't want to demean. You don't want to guilt trip. You don't want to criticize them. You don't want to act like you know it all. I mean, one trick that I learned at Triton is you want to play dumb. You don't know, because that's how you gather information. And also, what you don't want to do is scare tactics, because as a teen, what they naturally do is take risks. So, that can also be a way of glorifying and romanticizing the substance, because you just never know what's going on with the brain and the connection with different things like that. And also, you don't want to overshare your experience with substances too, because then it turns into a back and forth of, well, and that's the same that goes exactly with the same thing within the substance use world, is being aware of your boundaries about, it's about the client. It's not about you, and oversharing and whatnot as well. So,
kids like to use that as you're a hypocrite. Right. So you did it and you turned out okay.
Yeah, why can't I? Or you know what? That's not going to happen to me.
That's not going to happen to me.
And that's the same thing with adults too, And I know a lot of people that experience this is me, that's you, different things like that. And so what you can do is have a talk. I'm really concerned. We love you. What's going on? Talk to us. We're here. Try to like put the phones away and just level. We're here. I know it was tough when I was in school. I mean, you can relate back down, and if you're really concerned, again, go through the room, check the social media, check out where the friends are. If they say where they're going, follow them.
I actually am I encourage families to be upfront about the restrictions on privacy in this regard. These are your kids, and yes, they are, you want to respect their privacy, but if they're being suspicious, I think it's reasonable to say, I'm concerned and I reserve the right to make sure you're safe. Yeah,
because if not, safety is going to look, well, safe as a teen is already skewed. Then you add substances, who I'm surrounding myself with, and the whole gamut. Now, pretty soon I'm going to be tuning you out, and I'm just going to do what I think is right because I am safe. It's not like we're, doing yada, yada, yada. We're only doing this. And so being able to, be able to say, yeah, I am your parent. You're right. Because the world there's a lot out there. And also, it's a respect piece. If you share with the teen where you're coming from and why, and here's what's going to happen, that goes a lot better than, well, we're just going to take everything away and you're grounded for a month. And that's that. That's not a teachable experience. You want to try to teach as well. And if you don't know how to teach, again, that's why we're doing this, is to say, hey, call us up at Konick and Associates to be able to further assist with this, because we can only do what we can do. And just like counselors, that's why we consult, with each other.
I think Amber has openings to work with you and teens. Our model is to work with families. So when we're working with teens on these issues, we are going to be integrating the parents into that process. And if it's not too late to kind of reconcile some of these, because I think some of these behaviors create a lot of separation between parent-child, a lot of parent-child conflict, and kids get frustrated because they feel like they're being violated. Mom snuck into my room when I wasn't home and searched it. We can work on ways to rebuild that trusting relationship and still, work on safety planning, work on ways to manage those behaviors so that you can build that foundation of trust back up again in a safe way, and being pretty transparent about how all of this is meant to look in your family. So
you can't separate the individual and not bring in the family.
Yeah.
You just can't. You got to bring in the significant others as well, too, because it affects everybody.
And also, a lot of times we're working with kids that are in situations where both parents may not live at home. So if they're divorced or separated, it's really kind of talking about that from multiple angles, helping with co-parenting and things of that nature as well. So absolutely. Amber has openings. She's available for consultation with parents, for teens. She does have great rapport with the teens. And for more information, you can schedule a time to connect with us or one of our other therapists at KonickandAssociates.com, or you can email us at info at KonickandAssociates.com. And our next session, just for your information in this series, Amber and I are going to be talking about the impact of substances on the developing brain. So we're going to get a little bit more into that next week on March 3rd. And then the following week, we're going to be talking about the warning signs of depression and risk for suicide. That'll be on March 10th at noon. So join us on Facebook Live, and we will hope to see you then. Thanks, everyone.
Thank you.